can you die from dementia? And how does it kill you? Dementia is an umbrella term for over 100 types of progressive brain conditions that include Parkinson's disease, Alzheimer's dementia, vascular dementia, and Lewy body dementia, just to name a few. With the aging population, we are seeing 1 million people diagnosed with a type of dementia each year. It's no wonder that people worry about developing dementia one day. We all know someone that, or we know someone that has received the diagnosis of dementia. The good news, however, is there are things you can do to prevent dementia. These diseases have different signs and symptoms in the early stages of the disease. Over time, they all have symptoms of memory problems, thinking, and challenging behaviors. It is during the late stages of the specific conditions that the symptoms are the same, meaning all of these 100 types of dementias that there are, the early stages are very different. But as people move into the mid to late stages of those conditions, the symptoms become very much the same. And family members often ask me about, can you die from dementia? Many family caregivers providing for a loved one with dementia worry that this will be their fate. I did a lesson on dementia hereditary? Because there are so many different types of dementia. I have covered the specifics on that topic in detail. Right now, I'm just going to discuss how to decrease your chances of getting dementia. At the present time, there are over 60 million people have a type of dementia in the world. It's important to note that you are not destined to develop this condition. There are tens of millions of individuals that do not have dementia and will never develop it. Research has shown that you can take steps to decrease your chances to develop this condition. So let's talk about what you can do to lessen your chances of developing dementia. Incorporate a healthy diet and maintain a healthy weight as part of a dementia prevention program. Getting the proper nutrition with recommended daily amounts of vitamins and nutrients can protect you from a list of diseases, including dementia. Make exercise a part of any dementia prevention program. Research shows that physical activity can delay the progression of dementia. Hey, even light exercise can be beneficial. The recommended amount of exercise is 150 minutes of moderate exercise a week. The good news is that even 10-minute increments several times a day can make a difference. So take time to get out and go for a walk or a swim or a bike ride. Enjoy nature every day. It can improve your mood and go a long way to increase those neural pathways as part of your dementia prevention program. Refrain from smoking and drinking. Oh, that's a hard one for a lot of us. But if you can't stop, try to limit those behaviors to stay healthy. There is another benefit to not taking up these habits. It may prevent you from contracting respiratory illness, cancer, and other diseases, as well as saving you tons of money. Cigarettes and booze are expensive. I have discussed in previous lessons that what is good for the heart is good for the brain. A heart-healthy diet will not only help you maintain a good weight, it can help your blood pressure. It's important to be sure your blood pressure is always at a healthy level. If you're an individual that struggles with a healthy blood pressure, have a discussion with your doctor. I recommend that you look into vagal breathing techniques to help you lower your blood pressure without medication. It takes practice and can be done any time of the day. By the way, you'll see there's monitors now you can buy to tell you how to breathe and lower your blood pressure. You don't have to purchase those. Just look up vagal breathing techniques to lower your blood pressure. You can follow those techniques without having to use any kind of technology at all. But if you don't have the wherewithal to be consistent and you feel better having something monitored, spend the money on one of those devices. But they do work. Paying attention to your overall health is an important part of any dementia prevention plan. Make it a lifelong habit to get regular checkups and to be screened regularly for preventable and treatable conditions. This is a way to increase your chances if an abnormality is found and can be treated early. Hey, I recommend that you have a mini mental status exam done on a yearly basis. The mini mental status exam needs a baseline, and it will only pick up changes in your thought process or cognition over time. So I recommend you start having them in your 50s. Is it what the doctor's going to want you to do? No, ask for it. It can't hurt. A baseline is important. Another test I recommend is the St. Louis University Mental Status Exam, also known as SLUMS, SLUMS. This is another screening tool for detecting mild cognitive impairment. It will identify mild signs and symptoms that the mini mental status exam will not. So if you are over the age of 60 and concerned about developing dementia, this is the tool that will help identify symptoms early and allow for early treatment. On Caregiver Relief, you can find animal name testing, clock testing, Cognistat is another test, mini mental status exam, and St. Louis University mental exam. The pros and cons of each of those tests are on the website and access to those tests as well. So you can actually do them from home. The thing about doing the tests at home is you need a professional to review the results. That's important, but they are out there. So do the research and check out those tests. And lastly, to decrease your chances of developing a type of dementia, stay social. Although that's a hard for some. I always think of the Simon and Garfunkel song, "No Man is an Island," always comes to my mind when I talk about the importance of being social. Humans are, by nature, are social beings. We all need to celebrate, share our pain and our sorrows, and we all face struggles in life. So keep friends and family, and sometimes that family is of choice, not birth. Boy, do I know that one very well. Keep them close to you. Share your thoughts, even on a bad day. There are many stages with dementia. For the most part, the majority of dementias are slow progressing conditions. Many patients receiving the diagnosis of dementia can live for several years after the initial diagnosis. And I have seen several that have lived a decade or as long as 20 years after being diagnosed with the disease. While the progression of the disease may be slow, there are presently no cure for this condition. This disease will lead to death in the final stages. There are a variety of deadly complications that lead to death. I always recommend that in the mid to end stages of dementia, you ask for a referral to palliative care. I think that utilizing aggressive medical treatments for healthcare issues caused by dementia could cause undue stress and discomfort while rarely prolonging life or improving the quality of life. So with my years of nursing experience, I will tell you, it is hard to know what will shorten a lifespan. A small fall or a urinary tract infection or pneumonia can become deadly. The complications of dementia can lead to death. Knowledge is power. You have lots of information on dementia and the disease process in this series. I have also tried to help you understand how it may affect you and your family member. It can be a challenging diagnosis, but support is available to you here on Caregiver Relief. I'm Diane Carville, RN of Caregiver Relief.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.